I'm Dr. Joseph Amaro. My patients have asked me to put together this presentation on holistic healthcare, chiropractic, and applied kinesiology. Before we get started, I'd like to talk a little bit more about my personal life. I attended New York University and I graduated from New York Chiropractic College. After graduation, my wife Lynette and I moved to Scottsdale, Arizona, and we opened a practice. We have been in that same location ever since. And here are our two sons, Chris and Greg. People often think of their chiropractor as a back doctor who treats only spinal and musculoskeletal problems. But chiropractors have become the back doctors who treat non-back problems in a holistic way. We do this by addressing the underlying cause of your problem, be it spinal or otherwise. How often have you gone to your doctor with a health concern only to leave with the less than satisfying feeling that it was not properly addressed? You ought to have more from your healthcare provider. You deserve a person who will oversee your health care and deal with the cause of your problems. We have a mission statement. We treat the patient, not the disease, and the cause, not the symptom. Treating symptoms is allopathic medicine. Treating the cause of the problem is holistic or alternative health care. As I just mentioned, holistic health care is very different from mainstream medical care, in that holistic practitioners do not believe in treating symptoms. We want you to get well naturally by addressing the cause of your problem. Just as poor coronary circulation to the heart can refer pain to the chest and the left arm, other stressed organs can affect different areas of the body as well. For instance, the cause of lower back pain can be a weak kidney. TMJ or jaw pain can be caused by a congested gallbladder. But in a situation like this, what would you rather do? Take pain medication to conceal the symptoms, or address whatever is really causing the problem in the first place? Remember, if the cause of your health concern is not treated, your symptoms will keep returning, no matter what kind of therapy or how many treatments you get. Okay, now that we have an understanding of what's going on, let's show you how it works in practice. Hi, Amanda.
Hi.
Okay, we're going to test some muscles in your lower back today, and let's see what we can find, okay? Okay, lift this leg up in the air. I'm going to push down and out. Resist with all of your might. Hold tight. Okay. Now let's try this one. Up in the air, turn your toes outward. Resist with all of your might. Ooh, that one's a little on the weak side. So this muscle here is supporting your whole lower back. And if it's weak on that right side, it's a good possibility that that is what's causing your lower back pain. So what we're going to do today is just try and fix that, then give you an adjustment and see if we can't get you some relief. Okay? Okay, good. First thing we're going to do is just try and see if the problem might be coming from your foot. Let's try this again. Lift your leg up, hold your foot out, resist with all your might, hold tight. Okay. Did you notice a change in strength there? Mm-hmm. Okay. I'm going to give you an adjustment in your foot. What does my foot have to do with my lower back? Well, your foot is connected to your ankle supports your knee supports your hip, and your hip supports your lower back. So if we've got a problem here, we could very well have a problem in here. Does that make sense? So we're going to fix that problem now, okay? Now usually we can use an activator for this, or we can just use a quick manipulation, and it's really very, very fast and very light, like that. Is that okay? Mm-hmm. That hurt?
No.
Okay, good. Lift this up in the air, turn your toes outward, and resist me with all of your might. Much, much better. Very, very good. Now, we could have you turn over and we can give you an adjustment, and the adjustment will hold now since that muscle is stronger. Okay. Okay, Amanda, now that you've turned over, let's see if we can find anything else in your back that needs to be fixed. Okay? All right. Okay. Usually, bend your knee here. Hold tight for me. Okay, hold tight for me. Okay, hold tight for me here. Okay, so you got a little bit of a problem in your hip on your left side. So we're going to fix this with this activator. It's going to be a little, you're going to feel a little plunk, just like that. Okay? Okay, good. Is that all right? Mm-hmm. Okay, good. Now, okay, we're all set for today. That's all I need to do for you for right now. But I want you to stand up and see how that feels.
Okay. That does feel better.
Great. Here's a partial list of things that stress the body, affecting the immune system as well as the musculoskeletal system. Food, pet, plant sensitivities. This would mean white refined sugar, products containing gluten. Gluten is a protein and it's found in barley, rye, oats, and wheat. Corn, dairy products, soy products, and then of course there's dust and dander and pollen. We have toxic metals, aluminum from cans and cookware, mercury from dental amalgams, iron from cookware and iron supplements, and copper from water pipes. Toxic chemicals would include drugs, prescription drugs, over-the-counter drugs, and recreational drugs, herbicides, pesticides, formaldehyde, perfume, etc. Before we go further with more stressors, let's show you another demonstration. Well, this is Kira, and she's got a foot pain. So tell me, Kira, what happened?
Okay, it hurts right here. I woke up with it like a few days ago, and yeah, so it just like hurts right there.
Okay. Okay. Is this where it hurts over here? Okay. Let's see. Sometimes this may be affecting your lower back, actually, because I think, if what I'm thinking is correct, you might have a bone at a place in your foot that's affecting your lower back. So we might be able to get two for one over here. Lift this leg up in the air, turn your toes in. I'm going to push down and in. Hold tight for me. Okay, that's kind of weak. So I'm going to see if I can correct something in your foot, and let's see if it'll fix the pain in your foot. And also, it just might make your back feel better too, even if you don't have any back pain yet. Okay, you okay with that? Mm-hmm. Okay. Turn your toes in like this. I'm going to push down and in. Hold tight for me. Wow, much better. Very, very good.
I feel so much better. I can walk now.
Good. Continuing with environmental stressors, scars sometimes heal with raised connective tissue across acupuncture meridians, causing local or far-reaching pain. Dental and TMJ dysfunction. Possible causes would be malocclusion, biting surfaces of the teeth not aligned properly, toxicity due to amalgams, or misalignment of cranial bones or spinal vertebrae. Cranial faults. Contrary to popular belief, the skull is not solid, but is made up of 22 individual bones. Misalignment of the cranial bones can affect the function of the brain and the central nervous system. Emotions cause physiological changes in our body, and this results in physical symptoms. A good example of this would be a stress-related stomach ulcer. Electromagnetic stressors. These can alter the body's normal bioelectrical field. Computers, monitors, television, mobile phones, high-tension electrical wires. Your body's chemistry is unique to you. What vitamins or minerals are you lacking? And would you rather take these nutrients as pills or more naturally as food? Abnormal microbes. These include parasites, fungus, virus, and bacteria, which can affect the immune system, resulting in abnormal function and poor health. Other factors that can adversely affect your health are lack of exercise, fast food, not enough water, overuse of certain medications like antibiotics. Now, to show you how different areas of the body can be affected, this is Lenore, and she has some neck pain. Why don't you tell us a little bit about that, Lenore?